As kids get ready to head back to school, one thing to check off the to-do list before you send them into the classroom is an eye checkup. Because knowing kids can see clearly will make math and reading so much more easier and so much more enjoyable. And here to talk about eye exams for kids, I'm happy to have ophthalmologist Dr. Robert Block. Welcome back, sir.
Thank you very much. Pleasure to be here.
Pleasure to have you here. Yeah, let's start with the basics. Why these things are so important, especially right now.
Yeah, well, throughout the summer, the kids are outdoors playing. They're using all of their senses for learning. They're using their eyes, their ears, their taste, their touch, their smell. But once they get into the classroom, they're really just focusing, no pun intended, on using their eyes and their ears. And so if they're not seeing properly, they're starting at a disadvantage. And so getting them that eye exam, checking is really critical.
Yeah, when they're out playing in the yard, they're probably not trying to focus on things as small as letters anyways.
That is correct, yeah.
Yeah. So what's the difference now between the eye exams and the vision screenings?
Right, so a vision screening is a very, very basic type of test. It's not really going to tell you whether the child has any type of serious problem, or on the other hand, it will tell you if there's something grossly wrong.
Right.
So that may be a little bit of nearsightedness or a lot of nearsightedness, astigmatism or farsightedness, or if there's a muscle alignment problem, the eyes aren't working together, or sometimes if one eye isn't functioning properly, something called lazy eye or amblyopia as we call it.
Okay. Go ahead, please.
So the comprehensive eye exam is going to test everything. So we're going to test the ability or the acuity of the vision. We're going to test the motility of the eye, the ability of the muscles to move back and forth properly, the eye to track. And then we're going to look at the cornea, check the pressure for something called glaucoma, and look in the retina and just make sure everything is essentially okay.
And just to be clear, which one are you advocating that the parents out there do before the school year?
Right. I think that they should have a comprehensive eye exam.
Comprehensive eye exam.
Correct.
Okay. How about the different guidelines depending on how old the children are?
Right. So there are certain guidelines that are set up by the Academy of Ophthalmology and the Academy of Pediatrics. The first screening is going to occur when the child is born, before they leave the hospital.
Okay.
So the pediatrician or the family practitioner is going to check the red reflex and make sure that that's normal.
Okay.
If the red reflex is normal, that's the entire exam.
Just curious, what is that, the red reflex?
Okay, so shining a light into the eye, you should get a red glow coming out of the eye. Okay, it's not going to tell you much more than that.
Okay.
But that's going to tell you very crudely whether there's a problem in that eye, either in the cornea, the front part of the eye, or the retina. And so that keys you up. I mean, keep in mind, an infant, a newborn infant, it's a pretty tough exam.
Yeah, that's why I was asking. I didn't even know they did those things.
Right,
okay.
so we're not doing too much. Now, on the other hand, if that child is born prematurely, that child needs a comprehensive eye exam by an ophthalmologist, screening for something called retinopathy of prematurity that can permanently damage the vision if it's not treated.
Okay, let's move on to when they're about 6 months old to a year.
So 6 months to a year, second screening, going to be done in the pediatrician's office or the family practitioner's office. And that, again, is going to be relatively crude. Pen light exam, checking to see the reflex coming out. The two eyes should be aligned. There should be a reflex coming out. The eye should be centered. They'll maybe carry keys in front of the child's eye to see if the child will track properly.
Okay.
And that's more or less it. Okay, the next exam is going to come at around 3 to 4, and this is a much more involved screening exam because the child can identify objects at this point. So they'll show the child a picture of a house or a car or a truck, and the child will identify that, and they can vary the size of those objects and get a relatively good idea of what the child's visual ability is. The child should be able to see 20/40 at that point in time.
20/40 at that.
Okay. Anything that comes up as a red flag, the alignment being off, red reflex being off, child not being able to see that, then they get referred to an eye care professional. Next exam is going to be 5 to 6. Again, vision is the primary thing that we're checking for the acuity. That child should be able to see letters or numbers, and they should be able to see 20/20 vision at that point in time. Again, they'll check the alignment and the reflex. So the important thing for coming up at that exam is whether one eye is not working properly, that lazy eye again, and that's really where we need to pick that up because after age 6, very difficult to treat that problem.
Okay, now we sort of presented this as a back to school to-do list,
Correct.
but this is important for a lot more than just schoolwork.
It is. So I think that visually speaking, all of our social interactions are based on vision and hearing. And so again, if you're at a deficit with your vision, you're not likely to be as comfortable in that social situation. Mm-hmm. So that can impair your child's social development. Physically speaking, you know, a lot of the sports that we do are very visually oriented in terms of things being thrown at us or kicked towards us or something like that. Mm-hmm. And if you don't have the ability to track something from far to near because your vision isn't sharp at all ranges, that's going to impede your ability to excel at those sporting activities.
And so what are some of the issues that doctors are finding in these exams?
Well, as I mentioned, nearsightedness. So a child that's nearsighted may be inattentive when there's something going on the whiteboard. The teacher's writing on a board or projecting something. That child that's nearsighted might not be able to see that clearly, and therefore they may not pay attention. So that's a clue to the child having a problem. One of the things that I meant to mention is that frequently when we're dealing with children, they're not going to come out and say, I can't see, that things are blurry. They don't know to say that.
Right,
so
right.
we have to look for these other signs that might be causing that. Also, if a child's reading and they seem to skip words or skip lines, that may be an indication that they're having trouble focusing at that distance, and that child should probably have an eye exam as well.
All right, we're almost out of time, but real quick, just some tips for maybe college students too.
Right, so college students. So going away to college, if you're wearing contact lenses, you should not be sleeping in your contact lenses.
We hear that all the time, though.
We all do it, but you increase your risk of an infection that could be vision threatening by about 30 times.
30 times.
Okay, so you do it carefully, yes. But if you're, not being careful, you put the lenses in, you haven't washed your hands, this or that, you can set yourself up for a nasty infection. So you don't want to swim with your lenses in either. We all do that. That's not a good idea. If you're playing sports, you want to wear some type of protective eyewear.
Yep.
And then sharing makeup is not a good idea. Okay? And I would even caution about putting makeup on in a department store or makeup store, something like that. And then we want to get outdoors. So if I just have one extra few minutes, I just want to say that recent studies showed that an hour outside reduces the risk of developing nearsightedness by 2%. So actually when our parents were telling us to go out and play, there was a health benefit to that, more than just running around, because it helped prevent us from developing nearsightedness. One last thing, if I have just a moment. 20-20-20 rule. For every 20 minutes on a screen, try to take 20 seconds away and focus 20 feet away.
There you go. Okay. Every 20 minutes, focus on something 20 feet away for 20 seconds. Dr. Black, thank you so much.
Thank you so much.
We got a lot in there, really.
Okay,
glad to have you. All right, coming up next on Good Day Connecticut, Sean Pagano taking a bite out of something sweet and savory. Sean.
That's right, Tim. It is Foodie Friday, and it's all about the pies. Yeah, we've been talking about the meat pie and the